through cleanups, we've been coming across a lot of medical waste, kwa dump site, along the drainage, along the beaches, roads, and on sharing some of these pictures with the CEC Morogo and the Sub-County Public Health Officer, Mr. Nicholas, and the MOH, Emily, we came up with an idea, because we had to get down to the root cause of the problem. Why is this happening? Even when the hospitals are segregating, why is waste still ending up together, dumped at the dump site? So we came up with this training.
And the essence is actually to sensitize our managers of the healthcare facilities within Malindi Sub-County on healthcare waste management. We want them actually to adopt to better practices, because actually from the overview of how waste has been managed in Malindi, it has been in a haphazard way, and we have realized that this waste, when it is managed by the facilities, streaming up to the dump sites, and we end up actually having some heaps of waste from the healthcare facilities, issues of like blood syringes, issues of sharps, issues of contaminated kind of gauzes, they end up in the dump site. And we have realized these actually would be the sources of disease transmission, like issues of hepatitis B. You can get it from contaminated waste, either from the blood fluids, and even from maybe laboratory fluids. We have about 38 participants who are present today, and mostly we are targeting the managers of the healthcare facilities. And on Thursday, we also be here again, including the waste collectors, plus other managers of healthcare facilities, so that we have realized some of these facilities, they contract the waste collectors to actually carry their waste or transport their waste to the dumping site.
And finally, to conclude, as affiliation of Westwise Cities under the UN Habitat, that framework on solid waste management and segregation has really helped, because the same knowledge that is being transferred now to this particular training with the health workers is the same framework we are going to use when training also the private sector. So thank you, UN Habitat and the Westwise Cities.
This information basically it will be passed to various medical clinics to ensure that the issue of medical waste, the segregation and everything is dealt with.
We have come here so that we can learn more on waste management in terms of segregation, transportation and disposal. The hospital waste management is important for Malindi so that you can have a clean environment for the whole community.